Hi, welcome to Mind at Ease, where today we will be discussing anxiety. The purpose of this channel is to educate the community, reduce suffering, and also reduce the stigma surrounding mental illnesses. Today we have Dr. Jacob Palathinkal, who will be explaining what anxiety is and its related disorders. In 2017, there were 1.3 million ER visits due to anxiety-related symptoms. The most common symptoms that led to ER visits and are secondary to anxiety are chest pain and shortness of breath. Panic disorder is the #1 cause of ER visits related to anxiety, most being seen multiple times before being referred to a psychiatrist. Dr. Palathinkal, what is anxiety and at what point should someone seek help?
Anxiety is a normal part of day-to-day living. We all get anxious. We get anxious prior to school starting, prior to starting a new job, prior to public speaking, and obviously prior to YouTube channel speaking. But if you feel constantly anxious, you feel you're on the edge, you just can't settle down, you're having physical symptoms, can't sleep, it interferes your day-to-day living, then you should definitely seek help. According to the Anxiety and Depression Association of America, in the United States, anxiety is the #1 psychiatric disorder affecting more than 40 million Americans over the ages of 18.
What causes anxiety?
There are multiple factors that predisposes someone in developing anxiety, such as heritability, trauma, stress buildup, personality traits, substance abuse, or other mental health disorders that have comorbid symptoms of anxiety.
How is anxiety disorder diagnosed?
Anxiety disorders are diagnosed based on the presenting symptoms. When an individual walks into my office, I see that he or she is anxious. By their facial expression, they might be appearing flushed. Their rate of speech might be increased. Their affect might be once again very uncomfortable. Also based on rating scales such as the Hamilton Anxiety Rating Scale and other information obtained from the mental status examination. We also utilize obtaining additional information from their loved one. Mom would say their child is constantly endorsing, I'm worried, I'm appearing restless, that their husband is having difficulty going to work because of worries of conflicts at work. This constant, endless worries. And it's a very vital information in ascertaining a diagnosis of anxiety-based disorder. There are more than one anxiety illnesses. Anxiety is a symptom, but there are multiple disorders such as panic disorder, obsessive compulsive disorder, or OCD. Then there's PTSD, or post-traumatic stress disorder. These are all anxiety-based disorders, and these are all presenting with different types of symptoms as well.
What are the symptoms of anxiety?
Some of the common symptoms of anxiety-based disorder, whether it's generalized or other forms of anxiety disorder, is pressured or increased rate in speech, appearing flushed, a sense of general discomfort, restlessness, experiencing difficulty controlling their thoughts. I hear a lot of patients tell me that they worry constantly and their thoughts are racing from one worry to another or from one idea to another. Physical symptoms such as headaches, generalized or local pain, chest discomfort, gastrointestinal discomfort. Another major issue with anxiety or symptoms of anxiety is sleep dysregulation or having difficulty falling asleep because, once again, they're not able to control their thoughts. Not everybody may experience all of these symptoms. Some may only experience constant feeling of worry and restlessness, while others may experience all these symptoms.
What are the different types of anxiety-based disorders?
There are a few different types of anxiety-based disorder, but today we'll be primarily talking about panic disorder and obsessive compulsive disorder, or OCD. An individual who's presenting with panic disorder may not automatically come to the mental health provider initially. They might present to their general practitioner or even end up in the emergency room with sense of feeling overwhelmed, feeling like a sense of impending doom, feeling overwhelmed, chest pain, once again, shortness of breath. These are all symptoms that may appear in an individual who's having panic disorder. OCD, or obsessive compulsive disorder, is another form of anxiety based disorder, where the individual experiences rituals and compulsions or both. Some of the common symptoms of OCD rituals are washing their hands over and over again, checking and rechecking, having to walk through a door multiple times, versus mental compulsions can be praying multiple times before they feel as they're at ease. Internal rituals such as counting certain numbers or multiplying by certain numbers. OCD can be debilitating to the individual where they feel stuck in their own thoughts, where they cannot go to school, where they cannot leave the house. We've had patients come to the emergency room because their hands are so reddened and chaffed from overwashing. Once again, OCD can be debilitating. It could prevent anyone from experiencing any form of happiness.
How is anxiety-based disorders treated?
Anxiety-based disorders, whether it's panic disorder, generalized anxiety disorder, or OCD, are treated with form of talk therapy, such as CBT or cognitive behavior therapy, ACT, acceptance and commitment, and also psychodynamic focus therapy. Some of the medications that are used to treat anxiety based disorder, if they're experiencing panic symptoms, you may prescribe them benzodiazepines such as clonazepam or lorazepam. These are short term medications to reduce their struggles or acute symptoms. For long term treatment for anxiety based disorders, patients are also prescribed SSRI or selective serotonin reuptake inhibitors. These medications generally take a good 3 to 4 weeks before it starts working or take its effect. That's why it's important to start the patients if they're having acute symptoms on a short-term basis of benzodiazepines. Some providers also prescribe beta blockers, such as propranolol and other beta blockers to reduce physical symptoms related to anxiety, such as chest discomfort and muscle tightness, palpitations.
Can other disorders mimic anxiety?
There are medical disorders that may mimic anxiety disorder. Some of the common medical disorders are hyperthyroidism, whether there is a hyper or overfunctioning of the thyroid gland. There is asthma, where patients experience shortness of breath, electrolyte imbalances, adrenal dysfunction, or polycystic ovarian syndrome. These are some of the medical disorders that may mimic anxiety. So if someone experiences anxiety out of nowhere, it is a good idea to have a medical provider do a medical workup before coming to the conclusion that it's an anxiety-based disorder.
What are the long-term negative implications of not treating anxiety?
The negative consequences of untreated anxiety or undiagnosed anxiety are multi-layered. Initially, the individual suffers with these symptoms, going to multiple providers and not knowing what's going on. Then the family suffers as the patient projects his or her anxiety onto the family members. Patient goes through multiple providers, whether it's gastroenterologist or cardiologist, with physical symptoms of anxiety. So it's very important after a medical workup, the patient is referred to appropriate mental health providers for treating their anxiety. Anxiety and its based disorders are very treatable. There is no shame in seeking help. Help is out there for you.
Thank you for joining us today on Mind at Ease. If you have any questions, comments, or concerns, leave them down below in the comments section and we'll be sure to answer them in the next video. Thank you.